Welcome to our webinar focused on second look mammograms and ultrasounds. We're going to take a deep look at diagnostic imaging. And whether you've been called back for your screening mammogram or have breast health concerns, we'll take you into a procedure so you know exactly what to expect at your appointment. Our radiologists and breast surgeons answer the most common patient questions, and we're so glad that you could join us today.
Hello, my name is Dr. Kimberly C. Hutcherson. I'm a board-certified, fellowship-trained diagnostic radiologist specializing in breast imaging. I am the medical director of breast imaging at Northside Hospital Gwinnett in Lawrenceville, Georgia, and Northside Hospital Duluth in Duluth, Georgia.
So Dr. Hutcherson, after a screening mammogram, a patient may be asked to come back for some further imaging, which is referred to as diagnostic imaging. Can you explain what a diagnostic mammogram and a diagnostic ultrasound would be and why that patient would be asked to come back for that additional screening?
Diagnostic mammograms are reserved for those patients that have either clinical symptoms, such as a palpable lump that they have felt or the referring physician has felt, they have focal pain, they have dimpling of the skin, some nipple changes, nipple discharge, preferably bloody, or their callback for additional pictures that we saw in the screening mammogram. Once the radiologist interprets the screening mammogram, they may see an area of concern that they need to further evaluate or do some additional pictures on beyond their screening mammogram images. These patients are then called back to the diagnostic center for that evaluation. At the diagnostic mammogram appointment, they will receive additional mammogram images with either spot compression mammogram images to further characterize a mass or an area of whiteness that we see on the mammogram, or they may receive magnification views to further characterize some calcifications. If a mass is detected on the mammogram, an additional tool that we may utilize to evaluate that is called a breast ultrasound. We do dedicated breast ultrasounds of that particular area to determine if that mass is a fluid-filled structure, which is a benign cyst, or whether it is a solid mass. The solid masses then determine if they have smooth borders and they're maybe probably benign, or whether they have some irregularity to the borders and we thought to be suspicious for cancer.
I'm Dr. Christine Ormsby. I'm currently practicing in Festus, Missouri, which is just outside St. Louis. I kind of rotate from site to site.
Dr. Ormsby, today patients are able to choose between a 2D and a 3D mammogram when they come in for their screening or diagnostic imaging. Can you talk about the difference between a 2D and a 3D mammogram?
The difference is the type of images that we're obtaining. The types of views that we're getting are the same. So the breast is compressed from above and below and from side to side for each. The difference is that with a 2D mammogram, we're getting less views. So with a 2D mammogram, we're compressing the breast and we're only getting 2 pictures for each breast. So because we're getting less views, it's a little bit difficult to see through the tissue. So the breast is compressed and it's harder to see through all that tissue that's compressed on top of each other. So the X-ray tube just takes 1 picture of the breast. With the 3D mammogram though, the breast is again compressed from above and below and from side to side. The X-ray tube actually takes pictures, multiple views over each breast kind of in an arc. And the computer then regenerates those pictures, gives us multiple slices of that breast, and then we're able to kind of look through the tissue almost like we're looking through a loaf of bread. And so we can then scroll through that tissue from top to bottom, from left to right. So it gives us much more information with a 3D, and we don't have to try and figure out, is that just tissue sitting on top of each other? And we're able to see, is there actually something sitting inside that tissue?
Hi, my name is Dr. Nicole Nelson. I am the medical director at the Women's Wellness Center at Mercy Health St. Rita's in Lima, Ohio.
Dr. Nelson, some patients need to have a breast MRI. Can you explain what this procedure is and how it's different from mammography?
So absolutely. So breast MRI is another tool in our toolbox to help us find cancer or find out more information about a cancer that someone may have already been diagnosed with. So the MRI is done in an MRI machine. What you do is you'll be laying on your stomach in a specific piece that they add to the MRI machine to get really good pictures of the breasts. You slide through the kind of donut-shaped hole, and most of the MRIs that are done use contrast. So you'll have an IV placed by the technologist prior to going in, and the technologist will guide you through it. They typically take between 20 to 40 minutes, so it's a longer acquisition time, a longer time of imaging, and you'll kind of slide in and out of the machine. And they'll do different sets of pictures to show us the breast tissue differently than we see it in ultrasound. For some patients, we use it in individuals who are high risk or have extremely dense breast tissue. And it basically shows us everything. You can see through everything, and there's contrast. Most of what enhances on an MRI is not going to be cancer, but it's something that we kind of use its shape. Many of us use a dedicated 3D workstation to interpret these images. So we will look at the enhancement characteristics, the kinetics, and all different factors to help us decide, is an area worrisome or not? If we're using it for screening, do we see anything unusual? Or in a cancer patient or someone that's already diagnosed with cancer, sometimes an MRI will be used to get maybe better measurements because it might change the surgeon's surgical approach, but also to look at the other breast, the breast that doesn't have the cancer, just to be sure there's not something small hiding in there that we didn't see on mammography that would change the patient's surgical decision.
Dr. Ormsby, many women will experience breast pain at some point in their lifetime. Can you talk about breast pain in general, when a patient should seek attention from their doctor, and what breast pain can mean for them?
Breast pain is one of the most common things that we see at the breast center. A lot of times breast pain can be diffuse or involving the entire breast. This is typically a benign or non-cancerous finding. It's typically nothing to worry about, even though sometimes it can be quite severe. Diffuse breast pain can sometimes be caused by hormone fluctuations, which can cause some water retention within the breast, and sometimes excess caffeine intake. Sometimes larger breast size can cause some breast discomfort as well. Focal breast pain is a little bit different, where the pain is only occurring within one side in the breast. This usually warrants that we do some further workup. Sometimes we can have a mass or a cyst causing some discomfort in the breast. It is possible that we can have a cancer causing focal pain within the breast, but keep in mind it's very rare for that to happen. But it does warrant us doing some additional workup and some additional imaging just to make sure there's nothing causing that pain.
So Dr. Nelson, can you explain what are breast calcifications and the importance of finding them?
So breast calcifications are a common finding on mammography. It is your doctor's job to decide, are these worrisome ones or normal ones? Many women, actually most women probably have some calcifications. So in our training, we are trained which ones to worry about. So ones that we don't worry about are round, what we call lucent centered, calcifications in the skin, or coarse popcorn calcifications. Those are kind of considered benign pattern of calcifications. But there are some microcalcifications that are worrisome. We use fancy words like pleomorphic, which just means different sized and shaped. And then if they're kind of a branching pattern, those are the patterns that we look for that are the most suspicious. And then there's a whole host of calcifications in between.
When you are called back after your screening mammogram, you will have either a diagnostic mammogram or breast ultrasound, or both in some cases. The radiologist will determine which type of imaging shows the suspicious area best. A technologist will perform mammograms using special paddles and equipment, or an ultrasound, that allow a radiologist a closer look at the area of concern. If you have calcifications in your breast, you will have the area magnified so the radiologist can see their size, shape, and how many there are. The technologist will place a small paddle right over the area of concern and take x-rays using a magnification stand on the machine. If you feel a lump in your breast, the technologist will ask you to point to the area you're feeling so she can place a sticker on your skin. These stickers are visible on the mammogram and let the radiologist know exactly where you feel something. After all of your diagnostic imaging is complete, you will wait in the breast center for the radiologist's findings. Either the radiologist or the breast center staff will let you know what your next steps are. Your doctor will also receive these results. Thank you for joining us today as we explore diagnostic imaging. We have downloadable resources right there on the screen if you'd like more information. We hope you'll join us in our next episode, where we'll take an in-depth look at breast biopsies and pathology results. You can scan the QR code or click the button right there on the screen for more information on our breast health series. See you in the next episode.